Hi, my name is Robert Chelle with Chelle Law, and I assist physician assistants with employment agreement and independent contractor agreement issues. Today I'm going to talk about RVU compensation for physician assistants. So kind of how it works, what's a normal structure, and then maybe some red flags to look for as well. So first, what is an RVU? When you are compensating a physician assistant, you will use a work RVU, and what an RVU is stands for relative value unit, and it is a measure that is released from the Center for Medicare Services on an annual basis. And so every encounter that a PA has or CPT code associated with it has a numeric value, an RVU, associated with it. Usually somewhere between 1 to 3 would be the normal number. And then if you were compensating someone based upon RVUs, you take the RVUs produced, you'd multiply that times a monetary value, somewhere between $20 to $50 for a PA, based upon specialty and what you're working in, and then you just multiply. So if you produced 1,000 RVUs in a quarter, and you had $40 per RVU, you just multiply 1,000 times 40, and that's what your compensation would be. Now that's only if you're paid purely on production, which is not common for a PA. Normally, if a PA is paid RVU compensation, it's usually through a bonus. So, and it would also only normally be used in a healthcare network or hospital-related system. So if you are a PA working for a physician-owned practice, it's very unlikely that they're going to use RVUs as a means of compensating you. This generally is only used if you're working for a hospital or a large healthcare network. And so an easy way of doing a bonus structure based on RVUs is they would set a target amount. Once again, per quarter is a standard way of doing it. So if you're a PA, maybe you're doing family medicine, they'll say, all right, you have to hit 1,000 RVUs per quarter, and then any amount over that, we will give you a bonus. And so they would just multiply the RVUs over that target times whatever the compensation factor is. Let's just say it's $15. And so you would just multiply, if you produce 1,200 instead of 1,000, they would just multiply 200 times the comp factor, and then that's what you would be paid per quarter. And that's a very simple and kind of a common way of compensating a physician assistant for RVU production. Now, if you are paid only on RVU production, you absolutely have to make certain that you have some kind of income guarantee in the first 1 or 2 years of practice. If you are entering any kind of relationship where you're immediately paid based on RVUs, you're setting yourself up for failure for a few reasons. One, it takes time to build a practice up. No matter if you're replacing somebody or coming in fresh, it takes time to build up. And usually somewhere between 12 to 18 months is a reasonable amount of time for someone's practice to reach maturity. So if you were to start in month 1, your RVU production in month 1 is going to be much less than it is in month 12. So you don't want to, kind of get behind from the very beginning. So make certain if you're entering into an RVU compensation, structure, that it's an income guarantee, and I would say like a guaranteed base amount for the first year or two. It's not uncommon for large healthcare systems to use that exact structure. You would come in, they would give you a guaranteed base salary for the first couple of years, and then what they would do is they would take your production, sometimes from the last 6 months, sometimes from the last year, and then that would kind of be your base amount that they would pay you. They usually back it up a little bit. So for instance, let's just say you generated 120,000 for the previous year in RVUs. They would take that base amount and they say, all right, this is what you're going to be paid, moving forward as a draw. And they would back that up usually around 85%. And that way, if there's some kind of fluctuation in your RVUs, meaning you took a vacation, you're not going to get docked for not hitting that amount. And then you would get a regular paycheck at that 85%. And then they would do a reconciliation either monthly or quarterly, where they say, okay, well, this is what we paid you out, this is what you produced, and so they would then give you, the leftover as a bonus, assuming you exceeded the target. That's a pretty standard way of doing it as well. So that's a little background on RVU compensation for a physician assistant. If you have any questions about your employment agreement or independent contractor agreement, feel free to contact my firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Take care.